started, I would like to read the disclaimer that you see on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurse and is not intended to replace the recommendation or request of your healthcare professional. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Thank you, everyone, and good evening for tuning in to the PharmAssist virtual learning experience. This is the first online live pharmacy medication program brought to you by Mandel's Clinical Pharmacy. This educational program brings you together with outstanding healthcare professionals right from the comfort of your own home. My name is Tony Newman. I'll be your host tonight. I've been a nurse for over 10 years in the New Orleans area, and my last 3 years specifically in fertility. The PharmAssist program takes place every Monday night at 7 p.m. Eastern. Tonight, we will be going over a live medication instructional program on 3 fertility products, the Gonolf ReadyJect pen, Progesterone in oil, and Sonara Patch. We also will have a live Q&A throughout the program, so please join us on Zoom or Facebook Live, and we invite you to bring your questions in either format. Every week, we have a different healthcare professional from across the nation that will provide you with real-world experience, just as if you were sitting across from them at your clinic. Tonight, we are joined by Roxanne Kennedy, who's a nurse. Thank you again for your time and interest, and now I will turn it over to you, Roxanne.
Hi, everyone. I'm Roxanne Kennedy. I'm a nurse. I live in North Carolina. I have been an infertility nurse for the past, I think, 11 years, and it's been really fun. So I miss sitting down with my patients and doing these face-to-face video, or not video, but face-to-face instructional medication tutorials. And so, you know, with COVID, we've done a lot virtually, and it's great that we can come into your house on Monday nights and talk about medications. So Tony, I'm ready if you want to go ahead and get started on our first video. I think we're talking about Gonolf ReadyJect pen first. Hi, everyone. Today we're going to talk about administration of Gonolf. So Gonolf comes in a pen device, looks like this, and Gonolf is FSH, follicle stimulating hormone. So this hormone is a hormone you make in your body every month. You typically have an increase of FSH at the beginning of a menstrual cycle, and that helps to recruit a follicle, and that follicle will hopefully mature and ovulate and may or may not fertilize. But our goal is to create multiple follicles or eggs during an IVF treatment cycle so that we can really optimize your IVF egg extraction. And so we want to give you higher doses of the hormone that you already make in your body every month. And so we can do that using this FSH Gonolf pen. So the first thing you want to do when you get ready to give your Gonolf dose is to make sure that you have a nice clean workspace, wash your hands. You'll often be given some alcohol pads that you can clean the skin, and you can also potentially just use soap and water if you've run out of alcohol pads or didn't have them to begin with. So make sure you have everything clean. And one thing you'll note when you get your medications from the pharmacy is that Gonolf is actually refrigerated. So when you receive your medications from the pharmacy, some things might come in a cooler pack and some things might come outside of the cooler pack, and anything that's in that cooler pack, you always want to put directly into the refrigerator. And so you'll go ahead and grab your Gonolf pen out of that refrigerator. Now, it's up to you if you decide that you want to let that get to room temperature before you give your dose. It's not going to take long for that to happen. But there's, you know, if you're running behind and you want to make sure you get your dose in, you know, within that appropriate window that your physician or nurse has instructed you to do, there's nothing wrong with pulling it directly from the fridge and injecting right away. You do not have to let this get to room temperature. Again, that's just patient preference. So once you do get your Gonolf out, The next thing you want to do is you're going to grab one of these these disposable needles that are going to attach to the end of your Gonolf pen. And you should get multiple of these needles that go along with your Gonolf pen. There's not another alternative that you've gotten in your arsenal that you could use for this. Usually there's 10 or so that come in each pack. And if you ever need more, you always want to make sure that you follow up with the pharmacy to let them know you're running out, or let your nurse know. You should never be reusing needles, especially these disposable ones. So you'll get your Gonolf ready. And the other thing you want to do is note how many units come in your Gonolf pen. So Gonolf comes in several different unit markers. It might come in a 900 unit pen, a 450 unit pen, or a 300 unit pen. And so you just want to make sure that you're always keeping track of this somewhere. Often I'll tell patients to keep this like a checkbook. So be writing down somewhere, today is Tuesday and I'm opening up my 900 unit pen and maybe my dose is 150 units. And that way you're always keeping track of what you started with, what you're using each day. And if your nurse asks you, are you going to have enough medications to get through the weekend? Or you always want to know how much you have in your inventory so that you make sure that you don't run out. So when it's time to give your Gonolf, you're going to get, again, multiple pen devices, depending on how many how much dose you're meant to take each day and how long your medication protocol is going to go for. And again, each dose is a multi-use pen. So, you're not going to be administering, if this is a 900 unit pen, you're not administering 900 units a day. You're going to be using this multiple times. So each time you're not using it, you put it back into the refrigerator until the next day. So your pre-filled Gonolf pen is here, and it has all the unit markers at the top. But again, I don't recommend looking at where the liquid is in relation to these hash marks. It's always going to be much easier to tell, especially when you're taking very small increments and small doses of this medication, to be keeping track of it somewhere else. So once you're ready to administer the Gonolf, you're going to peel off the paper backing off the end of your disposable needle. And you want to screw it onto the end until it's nice and tight. Once you get it on there, it's going to have two safety caps. So you're going to pull off the first one, set it to the side. Don't throw this away because you are going to need this in a moment. And then you're going to pull off the second safety cap, which is this little tiny blue cap, and exposes your short, friendly, subcutaneous needle for injection. Now, your injection sites for Gonolf are going to go to your lower abdomen or to your outer thigh. So if you're using your lower abdomen, you can kind of think of your abdomen as a happy face. Start on one side and you work your way across. Remember, you'll be injecting potentially multiple shots per day. So you want to make sure that you're using all of the spots that you have on your abdomen and not injecting in the same spot twice. You can start on one side and work your way across. If you're injecting into your outer thigh, you can, think about it as the part of your thigh that if you were sitting down closely next to someone, it's the side of the part of your thigh that might be touching that person. So you can use your outer thigh or your abdomen, and you can alternate. You can mix and match. You might put one in your abdomen and another in your thigh. It doesn't matter. Whatever you choose, it's totally up to you. So when you're ready to give your injection, cleanse the site, soap and water or a little alcohol pad, and you're going to pinch the skin. So you're going to pinch the skin and you're going to put the needle straight in all the way down to the hub. Now, I'll often tell patients, and I did forget to mention the most important part, which is actually first to dial in your dose. And that's a really important part about the Gonolf. Before you go ahead and put your needle device in, you do want to dial in your dose. And if you look in the window, and it's kind of hard to see here on the screen, but at home, you'll be able to look in your window and you'll be able to see that you can dial in your dose, and it actually goes in increments of 12.5. And so you're going to find your dose. Let's say my dose is 150 units. So I'm going to dial in. And the nice thing about the Gonolf pen is actually you can dial back and forth on this pen. So you might get a little trigger happy and dial past your dose. Not to worry, you can dial back and forth until you get the dose that you need. Once you have that dose locked and loaded in the window, now you're ready to do your injection. So pinch the skin straight in all the way down to the hub. I usually tell my patients that it's a good idea to leave the window facing up so that when you're looking down, when you're doing the injection, you can look down and see, okay, so I'm starting with 150 units or whatever your dose might be. And when you push down on the plunger, it's going to push all of the liquid into your abdomen, into the subcutaneous tissue. And now when you look in the window, you should see 0. And that lets you know that you've given your full dose for that day. Assuming you've zeroed out the pen, now you want to grab the big safety cap that you had on there, and you want to use that to remove the needle that's on the end. If you ever try to put this little guy on the end of it, you are just going to stab yourself in the finger. So best to not use this. Use the big safety cap. You're going to unscrew it. This is going to go in the sharps container, and this is going to go back into the refrigerator until the next day. One thing that to mention about the Gonolf is that it actually comes with a little bit of overfill inside each pen. And so oftentimes the manufacturer will say that there's about 75 to 100 units left inside, and that's bonus medication. And as you know, if you've paid out of pocket for these meds, they can be expensive. So it is important to use every last drop that's in here. We talked about how difficult it can be to use these little hash marks to kind of see how much medication is left. So what I recommend you do is, again, mathematically subtract out how much medication you've used versus how much was in the pen to begin with. And when you get to the end and it seems like mathematically you've zeroed out the pen, if you're due to give your dose for that day, go ahead and ask the pen for whatever you want. You know, you want 150 units, ask the pen for 150 units. It's not going to let you not dial into that dose. It will only administer however much is in there. But again, it's hard to know what's in there. So you may as well ask for what you want. So if I dial into 150, put on my needle onto the end and give my injection. If there's not 150 units inside this pen, the pen will stop at a number other than 0. Whatever number appears in the window is your remainder. That's how much you have left to give. If you find that you're trying to do math and figure out, I dialed in this and now there's this number I needed to subtract, you're doing it wrong. Let the pen guide you. If the 75 appears in the window, that means you have 75 units left to give. So you grab a new pen, you dial into 75, attach your needle onto the end, and give a second shot to complete the dose for that day. So it means some days you might be giving yourself an extra injection, but again, it's important to use up all this medication, especially if you're getting to the end of your treatment cycle. If you have enough medication to kind of eke out a day's worth of medication, then you don't have to grab a new, get to call in for a refill or open up a new pen. So again, the Gonolf is refrigerated in between uses. And so you'll just put the pen cap back onto the end of it, and you're going to stick it back into the refrigerator until the next day when you pull it out and give your next round of injections. So that's Gonolf. It's very straightforward. Again, always important, keep track of what you start with, what you're using, what you have left. So you can always let someone know if you're starting to run out of the injection. So that's your Gonolf injection. I wish you all the best of luck on your journey.
So one of the first questions we had during the video is, can you please explain a little bit more the purpose of FSH and what part of a natural cycle is it replacing for me?
Yeah, so I touched a little bit on this in the video, but so FSH, follicle stimulating hormone, it's a hormone we all make in our bodies. The hypothalamic pituitary ovarian axis is how we get this little surge of FSH at the start of a menstrual cycle to help to recruit a follicle. And so during a normal menstrual cycle, we just get a little bump of FSH, and that tells our ovaries it's time to make an egg. And as the ovaries respond, we recruit typically just 1 egg a month. And as that egg grows and matures, it excretes estrogen, and that estrogen shuts off the FSH. It's a whole negative feedback system. So because we want to maximize your egg retrieval cycle, we don't want to take you to egg retrieval just for 1 egg. We want to try to recruit as many eggs as we can. And so everybody has a resting antral follicle count, is a term you might hear thrown around, or AFC for short. And so that's your little resting potential eggs at the start of a menstrual cycle that are just kind of like hanging out, waiting to be called up to the front lines. And so that these high doses of FSH that you get when you administer Gonolf will help to recruit those little resting potential eggs. So that instead of recruiting just 1 egg, we can recruit as many as possible, grow all those eggs and let them mature until we're ready to extract them in the OR.
Perfect. I really like that explanation on AFC. I think that would be very helpful for people to hear. The next question we have, is it best for me to let my pen come to room temperature before my injection, or can I give it right out of the refrigerator?
Yeah, so we get this question a lot. You don't have to let it come to room temperature. It's honestly just patient preference. It does not change the efficacy of the medication, whether you administer it straight out of the fridge or let it sit on your counter for a little while. Usually what I tell patients when they're getting ready to do their injections is to just get everything kind of laid out so that you're not flustered when it's time to do it, especially that first night. It's always drama and my God, what have I signed up for? So, usually I'll say like, grab your meds from the fridge, set those on the counter. And while you're mixing up potentially your other injections that you might be taking, that can be coming to room temperature, kind of all at the same time. And that way, you don't really have to think about it. Is it cold? Is it room temperature? Is it okay? Just give it once you have everything all ready to go, and then you can do all your injections back to back.
Another question we have is, how many days can I anticipate being on Gonolf?
That's going to be up to your provider and your clinic. Every clinic is a little bit different. Every protocol is a little bit different. Some clinics have patients starting their injections all at the same time right at the start of a menstrual cycle, and other clinics kind of add in medications throughout the cycle. So you always want to make sure that when your nurse is ordering your injections, that they are ordering you, and you should ask them, is this going to be enough potentially for my entire cycle? Do you foresee that I might need refills? Usually what I tell my patients is I'm going to order you enough for what the average patient cycle is. And so the average patient takes about 10 days worth of medication. You might need more, you might need less. I'd always rather make sure that you are going to get at least enough for the average cycle. And then we'll talk as you come in for visits to decide how you're responding and whether or not we think you need refills. The worst thing would be is if you ran out of meds on a holiday and had nowhere to get them from. So I always want to make sure that you have enough to need to get through the cycle, however long that may be.
Yes, I agree. And I liked in your video also how you talked about kind of keeping an inventory. So that's one big thing we do in our office as well, is just make sure that the patients kind of know at their baseline visit. We expect them to know at each visit what they are, what they have left at home. So if they need more, we can get them more. And then just to, be responsible for, what you have at home. So.
Yeah, I always tell my patients to keep it like a checkbook, and then everybody always laughs and says I'm old because who keeps a checkbook anymore?
That's true too. That's what we give them, a old school piece of paper, but then I'm like, okay, if you don't want to use the paper, then take a picture of it or put it in your notepad in your phone. So
exactly,
typically people get it, once they have to call on a weekend, I don't have meds. It's not fun.
Yeah.
So it looks like we do have another question. What do I do if I don't have enough medicine left in my pen to give the full shot?
Yeah, so I touched a little bit on this as well in the video. So always keep in mind that there's typically some overfill in each pen. It's hard to say exactly how much is in there, but most of the time I find patients get at least 75 to 100 units of overfill in the pen. So if you think there's not enough in your pen, you don't really know how much is in there, ask for the pen for what you want. It won't stop you. You can dial into whatever you want, give your injection, and the pen will only administer as much as is left inside the cartridge. So if you want 150 units and you dial in 150 and now the pen stops at a number other than 0 and maybe that number is 50, that means that that's your remainder. So there wasn't enough injection, there wasn't enough medication to give in that injection, and you need to take whatever number appears in the window, dial that into a new pen to complete your dose for that day. And always just let the pen guide you. So if you find that you're trying to add and subtract and you're just overthinking it, let the pen guide you. Whatever number appears in the window, that's how much you have left to give. If it's 0, you have 0 left to give. If it's 25, it's 25 left to give. So let it guide you and then dial that number into a new pen.
Perfect. Okay, so I don't really see any more questions on Gonal. I can just go right to progesterone unless you have anything you want to add. Good with that?
Let's do it.
Okay.
Today we're going to talk about progesterone in sesame oil injections. Progesterone is a medication that's used in most IVF cycles and many frozen embryo transfer cycles. And this is the medication that's actually going to help to support a pregnancy until your placenta takes over. And so this medication is very important. And this medication is also can tend to be somewhat daunting for some patients, in that it is one of the injections that will be administered intramuscularly. And the site for your intramuscular injections is going to be the upper outer quadrant of your butt. That is the only site that we recommend for these injections. Remember that this injection is mixed in sesame oil, which is a pretty thick substance. And so we always want to make sure that you're injecting it into the right spot. And most clinics across the board will advise you to administer this medication to the upper outer quadrant of your butt. So it's possible for you to have someone else administer this medication, but there's also lots of patients who end up doing these injections on their own and like the control of doing it on their own. So I can show you 2 ways for doing this injection, whether someone else is administering or whether you're going to be giving it to yourself. But the first thing you want to do when you're getting your progesterone injections ready, you're first going to need your vial of progesterone. And again, progesterone is mixed in sesame oil. This medication is not meant to be refrigerated. It is meant to be kept at room temperature. And you are also going to need a syringe. Usually your dose of progesterone might be 1 milliliter, but again, it depends on your clinic. Sometimes it's more, sometimes it's less. It's often patient specific. You're going to need an 18 gauge, 1.5 inch needle. That's going to be your mixing needle. And again, this needle, although it's big and thick, it is the best needle for drawing up progesterone because that progesterone is so thick that it does come out nicely with this big syringe, big needle. And then when it's time for your injection, you're going to change over to the 22 gauge, 1.5 inch needle. Now, this is the injection needle. A lot of people worry, why is it so big? Why is it so long? Do I really have to inject that whole syringe, that whole needle into my body? The answer is yes. The reason why the needle is as long as it is that it's not being injected into the subcutaneous tissue like some of your other medications were. This one actually needs to access the muscle, and that's where the progesterone is best absorbed. And so that is the reason for the length of this needle. And so the first thing you want to do is grab your vial of progesterone. And one thing to note about progesterone, it's actually a multi-use vial. Anytime you're dipping into a multi-use vial, multi-use means you're not going to use this vial for just one injection. It's actually going to be for several injections. You always want to clean the top of the vial with a little alcohol pad, and that just makes sure that you keep it clean, prevents infection. So you're going to pop the top off the cap, pop the cap off the top, rather, if this is the first time that you're doing these injections. The cap doesn't go back on. So that's part of the reason why you want to use the alcohol pads, because it's not going to be something that you can snap on and off. It comes off one time, and that rubber stopper prevents the liquid from coming out. And so you'll just always want to make sure you use an alcohol pad to clean it off every time you dip into it. So this is the first time I've opened up my vial of progesterone. I can use an alcohol pad just to be safe. Open up your alcohol swab, and you're going to clean off the top. So you'll want to get your syringe and needle ready. Sometimes they're connected and attached together, and sometimes they're not. This one is not. This is a 1 milliliter syringe here, and I'm going to attach it to the end of my 18 gauge, 1.5 inch needle. So I'm going to go ahead and show you how to drop 1 milliliter of mixing of the progesterone today. And again, your dose is going to be dependent on what your clinic advises you to do. So you're going to want to put your 18 gauge right into the top of that rubber stopper and flip the whole thing upside down. Pull back on the end of the plunger, and you should see your syringe start to fill up with liquid. Once you fill up, again, you can manipulate this, and sometimes it comes out slow. Again, it's oil, so don't expect for it to pull back as quickly as it might with some of your other mixing medications. But you can manipulate. You can push back on the plunger. You can pull back until you get exactly what you need. And you want to pull back until your rubber stopper, the top of your rubber stopper, lines up with the 1 milliliter mark. My syringe is continuing to fill up with the liquid. It's going pretty slowly, and that's okay. We'll let it continue filling up. Again, I'm going to keep manipulating it until I get exactly what I need. And once I have my 1 milliliter of progesterone, I'm going to be ready for my injection. I'm going to pull the needle out. Again, this is multi-use, so don't throw it away. You want to put it in a safe place. It is meant to be kept at room temperature. I'm going to safely put the cap back onto the end of my 18 gauge needle, and I'm going to remove it. And I'm going to put my 22 gauge 1.5 inch injection needle onto the end. So again, progesterone is meant to be administered to the upper outer quadrant of your butt. The timing of progesterone is pretty important. Your clinic might specify that you're meant to take your progesterone injections always in the morning or always in the evening. Usually they'll give you a 3 to 4 hour window for injection. It's important to try to stick within that window just to make sure that you're keeping a steady stream of progesterone in your body. So upper outer quadrant of your butt. You're going to find your site markings. So if you put your hand on your hip and you drop your thumb about 1 inch to 1.5 inches, it is the very top most upper outer quadrant of your butt. Another way to visualize this is to kind of think about like where the tag on your jeans might be, and you would go all the way to one side or all the way to the other side. It should, the new recommendations are that it should almost feel like it's going in your hip. You want to be avoiding the sciatic nerve, which runs right down the middle of each of your butt cheeks, and you don't want to hit that. That will be very painful. So you're going to go up and out of the way. You should be able to usually just glance over and see where those injections are going. And a really good thing to do is to ask your nurse to actually take a Sharpie, draw some circles on your butt, and that way you know you're going in the right spot each time. So if someone else is going to be administering this injection for you, again, you'll have your site already marked out, and it's a good idea. You want to stand up and you want to lean forward on a hard surface. And that way you can take the weight off of the leg and the butt cheek that you're injecting into. And that way it's not a tense muscle. So you're going to relax on that side. And the person who's doing the injection is going to, instead of pinching like we might with some of our other injections that are subcutaneous, now we want to spread the skin. So they're going to take their hands, they're going to spread the skin to stabilize it. And they're going to take the cap off the end. You can always use an alcohol pad to cleanse the site, again, or just soap and water. You're going to spread the site. The needle is going to go straight in all the way down to the hub. Once the needle is injected all the way, they can release this hand and use it to stabilize the syringe. Now what you want to do is you want to pull back a tiny bit on the plunger, checking for blood return. You just want to make sure you're not about to inject into a little vessel or something that might cause a big bruise. If you see your syringe fill up with blood, then you know you're in the wrong spot. You want to pull the whole thing out and you're going to inject into the opposite side. This, by the way, will not likely happen. Most patients, especially if you're going in the right spot, it's rare that your syringe would fill up with blood like that. And so assuming you don't see that, you're just going to go ahead and push straight in, push the liquid all the way in. Now, again, because this is mixed in oil, it doesn't go in as fast as some of the other injections might. And that's probably okay. You know, some patients don't want to have all of that oil pushed into the muscle, you know, in a really fast way. So it's fine if it just kind of goes in at the pace that it's going to go in. And you can instruct the person that's doing your injection to either go faster or slower if possible. Once the injection is all the way in, there's no more medication to administer, you pull straight out. Again, put the safety cap back on the end so that you don't stab yourself. And you can separate the syringe from the needle. So not all of this has to go into the sharps container. The needle can be separated and this can be placed into the sharps container. And this is just regular trash. This can go into the regular trash can. Now, if you are going to be administering this injection yourself, I always recommend that you get someone, the nurse, preferably in your clinic, to go ahead and take a Sharpie, draw some circles on your butt. That way you know exactly where your injections are going. If you were to try to stand up and like use a mirror and try to figure out where this is going to go, you're going to be putting in all kinds of crazy places. So it's a better idea to sit down and cross your leg one over the other. And if you lean over and you look for your injection site, again, you should be able to see it. You'll be able to see within the circle. You're just going to put the needle straight in, all the way in to the end of the plunger. And when you're using your dominant hand, you can actually go ahead and pull back a little bit on the plunger and check for blood return and inject. If it's ever with your non-dominant hand, sometimes it's hard to manipulate the plunger like that. So as long as you're going within the correct injection site, your chances of getting it wrong are slim to none. But it's really important. One thing to know is that you want to alternate each day. So you're going to go, you know, on the right side one day and on the left side the next day, and go back and forth and back and forth. And that way you're not fatiguing that muscle. Another trick is to take your hand after you do the injection. You're going to massage the injection site, help that oil to really get into the muscle. Walking around for a little bit afterwards also gets the muscle moving and helps that medication to absorb. And a lot of patients will end up using a heating pad. So usually we recommend using heat rather than ice when you're trying to get the oil to absorb into the muscle. And so a heating pad, whether it's one that you plug into the wall and sit on for 20 minutes, or they even make those, you know, those little heat packs that you kind of like snap and put on your butt and go about your life. Either way is totally fine, but it helps, you know, really helps take the edge off and helps with that progesterone to absorb into the muscle. Progesterone is one of those medications that you're going to be on for kind of a long haul. Again, it's a really important injection. That medication is the lifeblood of the baby. And so you want to make sure that you're continuing it until your physician gives you instructions to stop taking it. Some clinics will even have you do a tapering of that medication, or some will just have you stop it altogether. It's all just dependent on the clinic, so just make sure you follow along with those instructions. Those are your instructions for mixing up progesterone, and best of luck on the journey.
All right. So one of the first questions we have about the progesterone is, why are there multiple kinds of oil? Such as, I know this one's sesame oil, but then there's also ethyl oleate.
Yeah. So progesterone and sesame oil is one that you can just get like straight from the manufacturer. It doesn't require any special compounding. It's the standard standard concoction of progesterone. And so most patients do fine with the progesterone and sesame oil, but there are some patients who will actually develop a site reaction to the progesterone after repeated use. And those patients need to use a different compound. And so conveniently, Mandel's can whip up some progesterone and ethyl oleate for you. And so sometimes we do have to change patients over to that medication. It does tend to be more expensive than the progesterone and sesame oil, which is why we don't really start with it right out of the gate. But if you are a patient with a nut allergy, please let your nurse and your doctor know so that they can prescribe for you the ethyl oleate compound. And sometimes it's funny, I'll find patients who've gone through a treatment cycle, whether it was a fresh transfer or a frozen transfer using the progesterone and sesame oil, had zero problems, used it up until they were meant to discontinue, come back several years later for another embryo transfer and immediately develop a site reaction. So it's weird, you know, how it does kind of happen like that. It's like your body remembers, oh yeah, I had this once before. So just always, if you notice that you're having like itching or redness or almost like a welt-like appearance at the injection site, do not panic. It is very normal. And you can just contact your nurse and let them know, and they'll try to help you get a different concoction so that you can keep going with your progesterone.
Perfect. The next question we have coming in is there a best time of day to take my progesterone shot?
Yeah, so that's actually just going to be dependent on your clinic. So at my clinic, we always instruct patients to give injections in the morning. I also worked at a clinic where all the patients did the injections at night. So it's totally up to your practice, and everybody's got that magic number of progesterone injections given at a certain time that will result in a successful transfer. So whatever your clinic recommends is probably what they've been swearing by, and they'll feel strongly about sticking with that. So just always make sure you find out what time they want you to take it, you know, how big is the window. Like, you know, in my clinic, I'll tell patients, I'll usually say, take it between 7 and 10 a.m. But like for me, my day starts well before 7 a.m. So I would take it before 7. And usually that's okay, as long as you're consistent with your timing. You're not taking it one day at 5 and one day at 11 and kind of jumping all over the map. You want to be a little bit tighter with that window.
Yeah, I agree. We kind of do the same thing in our office too. Our shots are in the evening, but you know, everyone tends to have like dinner plans. And so I can see the fear like, oh, I have to take it right at 7. And I'm like, no, if you have to go somewhere, it's fine. Just take it, you know, before you leave, but just try to be as close to that same time. So
yeah. Live your life, go to dinner.
Yes. Enjoy it. The next question we have is one I get quite often. I've heard this shot's very painful. Is there any tips to help lessen the pain?
Yeah, so the progesterone injection, it's troublesome in several ways. One, of course, the needle is a little bit thicker, which I talked about a little bit in the video. It's a little, the gauge is a little bigger because it's mixed in oil. And so that going into the skin can be uncomfortable. And then of course, if you've ever had a vaccination before, you know that, once that medication starts going into the muscle, that's actually the part that's painful too. So in a few minutes, we're going to talk about Sonara patches. And so those are always a helpful way to help take the edge off before you give your progesterone injection. But if you don't have a Sonara patch, you can always, use heat at the site. Usually I recommend heat. Some people recommend ice. I just always think, oil when it's cold, or when you would, like, the same reason why we don't put our progesterone oil in the refrigerator, you wouldn't put your olive oil in the refrigerator, it starts to separate, it can become clumpy. So usually heat, I find, is a better alternative. But you can, some patients will take their hands and put the oil, the vial between, and kind of rub it together to help to warm it up that way. Give the injection, and then do a heating pad, like sit on one for 20 minutes. That's really all the heat you need. Whether it's one that plugs into the wall, if you've got time to sit and chill, or if you want to get one of those little like ThermaCare heat packs, put it on your butt, go about your life, move around, massage that site. Those are all ways to kind of help to take the edge off of that injection. And if you find that, like, gosh, I had a hard time on my right side today, and then, 2 days later when you're meant to inject there again, like it's still just not feeling better, give it a break, give it a rest. Go on the other side again if that's feeling okay. Don't feel like you need to torture yourself in the same spot over and over again. It's okay to, especially if you get like a little bruise or something, give it a little bit of a rest for an extra day if you need to.
Yeah, I actually had that exact conversation with the patient that came in today for their HCG test, was having a lot of pain. And so we just kind of talked about where she was injecting, and she was going a little too far over. So I think you gave some really good tips in the video about crossing your legs, sitting down, or holding your hip. I do think that's helpful, because I think people get too nervous to go too far out. So she's going to try that. And then we also recommended just giving that one side a break for a few days, because it does just get very tender. You're doing them for so long, you only have so many spots to do it, So yeah. Looks like we have one more question we can answer before we start going over the Sonara patch. Are there any side effects with the progesterone and oil that I should be worried about?
So progesterone, again, this is one of those hormones that you make in your body every month. And if you're someone who has a regular menstrual cycle, you might notice that after ovulation, everything just kind of starts to slow down. You might feel a little tired. You might want to go to bed a little bit earlier at night. You just kind of feel a little bit sluggish. That's the progesterone. That's what that does. And so the same is true for many women when they start their progesterone injections, that it does tend to just kind of slow everything down. Some women will experience constipation while they're using progesterone, and that can be common too. So, just listen to your body and the changes that you're experiencing as you're kind of souping up all these hormones in your body, and recognize that, yes, you do have these circulating in your body in a normal menstrual cycle, but that it's tenfold now because we're trying to achieve a different goal. So it's not uncommon to, to feel tired, sleepy, sluggish. All those things can be normal. If anything feels completely out of the norm, or you just can't bounce back or recover from it, certainly let your nurse know so that they can try to help you.
All right, so we're going to move on to the last medication tonight. It'll be the Sonara patch, and then we'll come back and answer some questions.
Hey everyone, today we're going to talk about the Sonara patch. So Sonara patch is a lidocaine patch, and this patch is often used by patients when they're in the intramuscular progesterone phase of the cycle. When you're administering progesterone injections, once a day, you only have 2 butt cheeks, you're alternating between the two, and sometimes those muscles get fatigued, and it can be helpful to have this barrier to help to numb the skin and help to take the edge off of the injection. So Sonara is like a sticker. So you are going to open it up. I can get into it. And here we go. You're going to open up your Sonara and you'll find a sticker inside. So it's really important when you think about whether you'll be using the Sonara patches, think about what time your provider has asked you to take your injections. So if your provider has asked you to take them in the morning time or whether it's in the evening time, Sonara actually has to be applied to the injection site for 30 minutes for the best efficacy. So if you're meant to take your injection in the morning, make sure you set an alarm like 30 minutes before you're meant to take it so that you remember to put your Sonara patch on, and that way you remember that it's going to give you the best numbing effect. So usually, again, these are going to be for intramuscular injections, and the intramuscular injection site goes to the upper outer quadrant of your butt. So that's here on one side of your butt cheek or here on the other side. And you're going to alternate. So try to keep track of which side you gave your injection on the day before so that you remember to put the Sonara in the right spot. So you're going to peel off the paper backing. It's actually more like a plastic backing. You're going to peel that off. And the Sonara is going to be placed directly to the site. So you're going to put it on and then you leave it on and you forget about it and you set yourself a timer for 30 minutes. And that Sonara patch is actually going to go and work into the skin with the lidocaine, and it's going to help to numb the area. After your 30 minutes are up, you're going to peel the patch off and you're going to give your injection within the spot that you had the patch before. And it's a pretty big patch. So you have a big window. It's not like it has to be an exact pinpoint. If your nurse or your provider has drawn circles on your butt with a big Sharpie so that you make sure you know exactly where your intramuscular injections are going, just stick this right into the middle of that circle, and that way you always know that you're giving it into the correct spot. And again, the next day when it's time to do your next injection, set yourself a reminder, go ahead and put the Sonara patch on 30 minutes before your injection, set a timer. When your 30 minutes are up, then you can give your intramuscular injection. That's Sonara. You might really like it. It might really help to, especially as you're getting towards the end of doing those progesterone injections for a long period of time. Sometimes it's really helpful to have this extra bit of cushion to help to take the edge off of those intramuscular injections. So that's the Sonara patch, and we wish you best of luck on your journey.
Okay. Quick and easy. That's not too bad. Right. One of the first questions we have for Sonara: what happens if I leave the patch on for too long? Is it dangerous, or could I accidentally overdose?
Yeah, so that it's actually just going to start to wear off. So, it kind of hits its peak at about the 30-minute mark, and then the effects of the Sonara just start to wear off. So it's not recommended to leave it on for long periods of time, but you're not in any real risk of overdosing or going numb in your leg for hours on end if you leave the patch on for too long. So again, a time, like I mentioned in the video, a timer is really important, especially if you're giving your shots in the morning or a busy evening. Timers are great anyways, right? Because I cannot tell you how many times patients have been like, oh my gosh, the day got away from me, or, something crazy happened and my cat threw up and I forgot to give my shot. So it's just always important to have that little extra reminder. And you'll definitely remember to do that. If you have to set one to put on the patch and then another to take it off, then you're not going to be leaving it on for long periods of time.
If I run out of a patch, can I reuse a patch?
You cannot reuse a patch once you've already used it. Again, the effects of it will have worn off anyways, so it's not going to be useful to put that patch on. Same reason, let's not reuse really any of our medical supplies. We don't want to be reusing needles, syringes, or Sonara patches, any of that stuff. If you start to run out, and again, it's always a good idea, just like we keep good track of our injections, like our Gonolf and other injections that we're taking. It's really important to make sure that if you plan to use it for the entirety of your injections, that you make sure that you keep good inventory of what you have so you don't run out.
I feel like you probably touched on this a little bit in the video and some on the first question, but how long does it take for the patch to wear off? I just don't want to accidentally leave the patch on and not feel anything.
Yeah. So the effects of the patch should be gone after about, no more than an hour. Again, it usually hits its peak at about 30 minutes or so. And so it's going to start to wear off, and you're not going to get the benefit of it if you don't administer it within that short window.
Good to know. Okay. I don't really see any more questions. So do you have any closing things, anything else you want to add, or?
Yeah, I wish all of you the best of luck. I mean, this is a stressful journey to be embarking on. And I say to my patients all the time when they come to me all wide-eyed and panicky when they get their medication delivery, if we didn't think that you could do this at home without a medical degree, we would all be at the clinic at night waiting for you to come by and do your injections. But this is possible. You can do this. It is amazing what we can put our minds to and what we can accomplish when we kind of get over that initial hump. And so we are here to help you and to help this journey be an easy, stress-free one. But always make sure you ask questions. Everybody's understanding and level of comfort when doing these injections is different. And some people are like, I got this, or I have a friend that's going to help me, and it's like no big deal. And there's other people who are just kind of quietly going through this, and they really do need, an extra hand. So we are here for you wherever you fit in that scale, and we want to make sure that you don't keep quiet. I always, number one thing, do not guess. If you don't know what you're doing, do not make it up. Always stop and ask someone. And most clinics will give you an option to page someone after hours so that you can get the answer you need. We do not want you guessing. We do not want you just winging it. It's really important that you do this right, because we want you to have the best end result.
Yes, I definitely agree with you on that. There's lots of resources out there. You can reach out to your clinic. You can reach out to your IVF coordinator. I mean, as much as no question is a silly question. We give our on-call line at all the, IUI baselines or the IVF baseline appointment, just in case there's something, that comes up after hours or on the weekend. So there's definitely a lot of good resources out there. So, yeah. And Roxanne's one of them. Thank you so much for joining tonight and sharing all your expertise. Thanks for everyone on Zoom and Facebook Live. We hope that you were able to learn something tonight. Even if you didn't ask a question, we do hope that we were able to answer some for you. Just a reminder that all of the videos that you saw tonight, as well as your product demonstrations, are available on our YouTube page, Facebook page, or the My Mandel's PharmAssist page. We truly believe that repetition leads to retention. Every Monday night, we do this show at 7 p.m. Eastern. So we look forward to seeing you then for another great program. And again, just share this with anyone you feel that can benefit from it, like a friend, colleague, or a family member. And thank you guys so much. We'll see you next week. Good night.
Thanks. Good night, Tony.
Bye.